My name is Kelly One. I'm a hand and upper extremity surgeon at the Southern California Orthopedic Institute.
What is cubital tunnel syndrome and what causes it?
Cubital tunnel syndrome is where there's compression of the ulnar nerve at the elbow or the funny bone nerve, and this can lead to numbness and tingling of the small finger and ring finger. The causes of cubital tunnel syndrome frequently caused by repetitive flexion of the elbow, which then compresses the nerve at the elbow and can lead to these persistent symptoms that can wake people up at night. The other causes include bending the elbow for a prolonged period of time or leaning on the elbow. The other causes include arthritis or nerve instability, where the nerve tends to roll over the edge of the inside of the elbow.
What are the most common symptoms patients experience early on?
Early on with cubital tunnel syndrome, patients experience numbness and tingling of the ring and small fingers. They often note these symptoms particularly at nighttime, or sometimes even during the day if they find themselves bending the elbow frequently. They can also experience some soreness in the elbow, and they may find themselves having to shake out their hand to feel like they can restore the sensation in their fingers.
What conservative treatments do you typically try before recommending surgery?
I often recommend activity modifications to avoid excessive elbow flexion and to avoid repetitive activities where your elbow is flexed. This can help alleviate the pressure on the ulnar nerve at the elbow. In addition, I also recommend at nighttime people either use an elbow brace or a towel wrap to keep the elbow straighter to avoid excessive flexion so that you don't wake up with the symptoms.
Can you explain what's involved in cubital tunnel release surgery?
Cubital tunnel release surgery is a common surgery performed by hand surgeons where the incision is placed over the ulnar nerve and then the fibers overlying the nerve that compress it are released. This helps alleviate that compression to allow the nerve more room so that it can conduct its signals more normally.
When should someone see a specialist about cubital tunnel syndrome?
You should see a specialist for cubital tunnel syndrome if you experience persistent numbness and tingling of your ring and small fingers that doesn't get better with rest, or that begins to wake you up at night. If you're experiencing difficulties with buttoning buttons on your clothes or holding a pen to write, it is also worth seeing a specialist to be evaluated for cubital tunnel syndrome.